We would now like to welcome Dr. Neil Riordan, founder of the Stem Cell Institute.
Thanks, sir. Thank you guys for coming. I really want to thank all of our patient volunteers who have given up their time and given us their energy to put this together. And I thank Cindy Cunningham, who organized this, Dr. Nocera for showing up, and all you guys for showing up. I really appreciate it. And you know, we're located in Panama City, Panama. I'm going to talk about the non-controversial stem cells, which Dr. Nocera has already touched about. I'm going to talk about the history of our odyssey, tell you about what we're doing currently, talk a little bit about different types of stem cells. One of my main messages is that I want to get out to you is that stem cells decrease with age. How your own stem cells can help you, and how younger stem cells from the perinatal can help you. And I want to talk about the safety of what we know right now about the safety of non-controversial stem cell types. So the history of our deal, we opened in Costa Rica in 2006 under ICM. We expanded to Panama in 2007. We consolidated our operations there last June. So now we're just located in Panama City, Panama. And there are two entities there. There's Metastem Panama, which is our laboratory. It's located in the City of Knowledge, which is a prestigious area with a technology park in it, and that's where our laboratory is. And then the Stem Cell Institute is actually in the city of Panama City, and that's where patients are treated. So little pictures of our lab. So we have 4 doctors in house, and you know we also utilize other doctors in the community. Obviously, we need people. We need plastic surgeons to do liposuction. We need doctors to do bone marrow aspirations. Dr. Jorge Paz Rodriguez is our medical director. He's a U.S. trained, board certified internal medicine, and he's going to talk next. Well, I think Dr. Nocera covered this pretty well. The embryonic, there are different kinds of sources from the embryo, from the fetus, which of course we don't deal with at all. There are postnatal. The umbilical cord and the placenta have. This is from a normal, healthy birth. After the baby is born, the umbilical cord is clamped, it's cut, the baby's taken away. The mother delivers the placenta and the umbilical cord. In the placenta and the umbilical cord is blood, and also the tissues that are there have another kind of stem cell in them. And then, of course, the adult, which is fat, bone marrow, we know teeth, and also menstrual blood. So the stem cells that are used at the Stem Cell Institute are either from the patient themselves, from the fat, or from the bone marrow, or from donated umbilical cord blood or umbilical cord, the actual tissue itself. So Dr. Nocera covered most of this, but I have a little different take. There are the blood-forming stem cells from bone marrow, which he covered in great detail, where they can go to a site of injury and repair other things. But there are also the tissue or the repair stem cells. I'm only going to ask you to remember one term that you're probably not familiar with, or maybe you are. It's the MSC, or the mesenchymal stem cell. The MSC, that's the only new term hopefully I'm going to introduce to you today, okay? And these MSCs they're found throughout our body. They home to damaged areas, they reduce inflammation, they make repair and regeneration factors. That Dr. Nocera you saw the cartoon with the little molecules coming out, and they also help to modulate the immune system. And I think in your packets there's an article I wrote about the bank account analogy, and there's age-related decline. Any kind of major event you have, you're in a big auto accident. All these cells that Dr. Nocera was talking about, they've got to rush out and repair that, right? So you've just taken a big withdrawal from your bank account, right? And another interesting thing is that some people are born rich and some people are born poor. Even though there's an age-related decline, some people start here and some people start here, right? George Burns, he drank and smoked and whatever else, never exercised, and he lived to 100 years old, right? So I think he was born rich. And you got Jim Fix, the guy, the jogger, dropped dead at 50 or something. All he did was exercise and eat health food. So I think he was born a little bit poor. And when you're out, you're out. So this is a real depressing figure. This is the number of these repair stem cells that are found in your bone marrow with age. And when you're born, you have 1 in 10,000 in your bone marrow. Okay? When you're a teenager, when you're a fully developed teenager, 1 in 100,000. And then it declines. It declines from there until when you're 80, it's 1 in 2 million. And you'll notice that there's a huge drop from when you're born until you're a developed human being. And that's because you're going from a 7-pound baby up to 120-pound, in my case, 125 person, right? So you have this big depletion, okay? So that depletion from the bone marrow, those cells have to go somewhere, so they're in the rest of the body. So this is the total body reserve. This is a theoretical total body reserve based on the best of our knowledge. And you can see that at around 20, it starts taking a dip, and 30 and 40 and 50. Around 50, we're on a real slippery slope, right? And there's a saying in Russia, it's translated roughly like this. After you're 50, if you wake up and you have no pain, you're dead. and you can see, after 50, I went and played golf yesterday, and I woke up this morning, and I'm definitely not dead. So I have plenty of pain. So this is from a book where they're looking at various functions from motor capacity, mental creative power, physical strength, fertility. And basically, if you average all of those, starting with a baseline of 0, you get that line right there. And I wish we don't have a pointer then. But basically, if you're born rich, you would start at 120 and follow the same curve down. If you're born poor, maybe you'd start at 80 and go down. So you're going to run out quicker. So these MSCs are found throughout your body, right? You saw that depletion from when you're born until you're fully developed. Well, where'd they go? Well, they're all throughout your body. And that's actually a photomicrograph. It's a picture of a blood vessel, and those are MSCs on the outside of the blood vessel. They reside on all our blood vessels throughout our body. So this is did anybody see the body exhibit that came through here? Well, this is the vasculature of a human being that they've stripped everything else away, and this is just the torso. You see going into the legs and the shoulders. And every one of those blood vessels is surrounded by these MSCs, so they're throughout your body, right? Here's a hand, is a close-up of a hand. So the thing that I want to point out, which they didn't use in somebody who had a lot of belly fat, but as the fatter we get, which is something that happens with age, the more of these cells are robbed from the vital organs, and they have to go to support the fat. So we're actually putting them, and Dr. Nocera said they're sequestered, or they're I don't know what the term he used, but basically they're not available if you need them for repair purposes. So we do a lot of work with fat-derived stem cells because you have this huge depot of these cells that are they're really not doing you a lot of good in the fat, but if you could get them back into the bloodstream, there's some profound effects that they can have on your health. And these are the MS, RA, osteoarthritis, and any condition that has an inflammatory component, there's inflammation, or there's a hyperimmune system, then the cells tend to be useful. So what's the problem? Activated T cell clones. These are a type of white blood cell. They attack the affected tissue. And in the case of rheumatoid arthritis, it's the joints. In the case of multiple sclerosis, it's the myelin that's found in the central nervous system, in the spinal cord and the brain. So the treatment rationale is based on the fact that both of these diseases are not a disease of the joints or the central nervous system. They're a disease of the immune system. Okay? And the secondary thing is the joints and the central nervous system. So these are what the MSCs do. They're general repair cells. They modulate the immune system. They can calm down an active immune system. In fact, the more hyperactive the immune system is, the better they calm it down. They're anti-inflammatory. There are also other cells in the fat that suppress the immune system. They're not stem cells, but they're a type of immune cell that is found in the fat that can calm down the immune system. This is the seminal paper showing that these stem cells were in fact, and from 2002, were found inside of the fat. And I'm not going to cover this because I told you I'm only going to ask you to remember one word. But this is immunologically what occurs with the cells. And this is a cartoon representation of what happens when a white blood cell becomes activated. It will produce more of itself, more daughter cells of itself that are activated against whatever the target is. And if I had a pointer, I would show you. But basically, where it says clones of the competent T cells are produced, the MSC, if it's in sufficient numbers in the bloodstream, even for a short period of time, will completely block that clonal expansion, which is what is making the army of cells that, in the case of MS, is attacking your central nervous system. In the case of rheumatoid arthritis, is attacking your joints. It blocks it. Okay? So the first patients we ever treated came from Dallas-Fort Worth area. And actually, 2 of the first 3 are sitting in this room right now that were treated with their own fat-derived stem cells. And they may be talking later. We've actually published a couple papers on using the stromal vascular fraction, the stem cells. Basically, it's all the cells that are found in the fat after you remove the fat. Okay? And about 1/3 of them are MSCs, and then there are other immune cells. The reason we wanted to go to the fat, because we know these properties of the MSCs, that they calm down inflammation, they help modulate the immune system. We know that they have all these properties, but to grow them, it's very difficult, very expensive to grow them. Well, from a single pound of fat, liposuction fat, we can get a couple 100 million cells, right? And that's a lot of cells. So economically, it makes complete sense, and it's a very safe procedure relative to other things, right? Well, this is the MS article. And in that article, we described 3 cases. Two of the people are actually in this room. They're transplanted with the MSCs, the old protocol, which is from the umbilical cord, basically umbilical cord stem cells, and the stem cells from their own fat. There was a dramatic improvement in all 3 cases. There were really no other side effects than liposuction. We collaborated with the University of California, San Diego on this. And I will say that I think the liposuction was a little understated, because I recall somebody coming in and pulling up their shirt and saying, "You call this a little bit of bruising?" But you know, there is significant bruising, but it goes away within a few days. This is our article on rheumatoid arthritis, where with rheumatoid arthritis, the treatment is just the fat. The fat is isolated, and the cells are taken out. They're quality controlled. They're given back in intravenous infusions, and that's it. Very simple. So I want to talk about a real dramatic case, which is not rheumatoid arthritis. It's not by itself, and it's not multiple sclerosis, but it's a very dramatic case of how the body can heal itself. It's just given the right tools. And this young lady, 28-year-old, came to the clinic in Costa Rica with psoriatic arthritis, which is just really a horrible disease. And she had one of the most advanced cases that anybody's ever seen. So again, it's these activated T cells, but now instead of just attacking the joints, they're attacking the skin, the hair, and the nails, right? And, of course, the joints. So it's a combination of psoriasis, a severe psoriasis, along with a severe rheumatoid arthritis, and that's what she had when she came. So these aren't pictures of her, because I don't have her permission to present her case. any identifying materials, but her skin was worse than this. And this is that you can see the nails are pitting and the skin excoriating, but you can see also the redness, and literally every joint of her body was affected. This is an example of toes, the nails. So she had lesions all over her skin. Her mom said she looked like a leper. That was her mother's description when she called to talk about the treatment. Her hair was falling out in clumps, and she only had a couple clumps left of hair. Her fingernails were splitting and pitting. All of her joints were red, hot, inflamed, painful. She couldn't even move her left arm. I mean, literally, it was completely incapacitated. She couldn't walk. She was in a wheelchair because of the inflammation of her joint. She had a mini liposuction done. She was given 100 million cells from her fat. She was given in 2 doses, and she felt better before she left. Well, it took quite a while. It took several months before she improved. But she came back to Panama for retreatment because I didn't show there's a lot of joint deformity that occurs when you have this huge inflammation going on in the joints. And she had joint deformity and some residual pain, albeit not rheumatoid pain. It was structural pain it was basically osteoarthritis pain from the structural defects that occurred when she had the rheumatoid thing. But I got to tell you, when she walked in the door, we were shocked because this young lady has a full head of blonde, beautiful hair. She has her nails are completely fine. No lesions on her skin. This was 10 months after her treatment. No lesions on her skin. Her toenails were fine. I mean, she had 2 plaques literally right here on her chest. And that was it. There was no sign, no redness. She had full mobility except for pain in her knees. Her left arm was back. She walked in the door. You wouldn't have known it was the same human being, right? And this is simple stuff. This is not anything big. All it is taking her own fat, isolating the cells, and then giving it to reset her immune system. That's it. Very simple deal. And without this treatment, this lady had tried everything. She would have lived the rest of her life in her mom's, in her mom's house. Now, she wouldn't even go out. She wouldn't let us take a picture of her before. We always take pictures of people when they come in. She wouldn't allow us to take a picture of her because she didn't want any record of it. But anyway, I tried to get her up here, but she couldn't make it. So the procedure, just in a nutshell, it's a mini liposuction. Okay, a standard liposuction, they'll take out anywhere up to several liters. And the plastic surgeon takes out a half a liter, okay, about a pound of fat, and that's sent to the lab, and it's digested and quality controlled, and the cells are removed. They're frozen down so that they can do all the quality control, make sure there's no bacterial contamination or anything else. And then once the patient's healed up from that, the liposuction, then they're brought back and they're given the cells in the vein to help reset the immune system. So, well, I just told you what happened. I had a slide on that, but, when she came back. So another thing that I wanted to talk about briefly, because Dr. Paz has other things to talk about, is spinal cord injury. And the problem with spinal cord injury is that it doesn't normally repair itself. The central nervous system, with that kind of a dramatic, there is some remodeling, there are some stem cells, but that dramatic of an injury, there's not enough oomph to help it repair itself. Okay? And so we believe the solution is to introduce cells that give chemical signals to start and complete the repair. And the biggest candidate are the umbilical cord stem cells. And this paper kind of says it all. Okay, what they did is they took rats and they cut their spinal cord, and when they do that, it goes boink, and there's a little gap, 1 to 2 millimeter gap where they've cut the spinal cord. And of course, they lose all function below that point. And then what they did is they took human umbilical cord MSCs, right? And they implanted them. They put a little bit of fibrin glue in there, and they implanted them around. Here's a graphic representation of that. So here's the gap that's occurred, and then they put the cells in the gap, and then they put it on basically on both ends of the spinal cord. and the spinal cords regrew. Here's the stem cells. They use a neural conditioned medium, which is from stem cells. It's basically the juice that the stem cells produce, and they got some benefit. But here's just implanting the stem cells. And the most interesting thing, and I don't have a picture of it, but because they were human cells that were transplanted into the rat, the most interesting thing is that then they cross-sectioned the areas where the spinal cord regrew, and they look under the microscope, and you can fish, or you can label human cells. And there were no human cells that became a neuron, or the insulating cell around the neurons. Those were all mouse cells. There were some human cells in there, but they were not part of the immune system. They didn't transdifferentiate. They didn't become the central nervous system. They just secreted the juice that gave the signals to the umbilical cord to heal itself. Okay? And this is a very great thing about adult stem cells, is they're not transdifferentiating. I mean, from the bone marrow, but this kind of repair cell doesn't become another tissue. It goes to the tissue and it says, hey guys, here's some happy juice, let's start repairing ourselves. Right? That's what they do. And they die off, which is great because you don't want them growing on forever like embryonic stem cells, right? So this is a case report that we wrote up. This is one of our first patients from Costa Rica with spinal cord injury, and his name is Juan Carlos Murillo, and he's an airline pilot, and I'll just let him tell his story.
Hi, my name is Juan Carlos. I had a plane crash, was May 13, 2008. And result of that, I have L1 injury, spine injury. And I had no feeling or movement below my head. First, I started here in therapy with nothing at all, with no movement or nothing. And I started my stem cell treatment in October 2008. After that, my neuropathic pains start to slow down in time and strength. And after the second treatment, it was in March, I think, in 2009, I started to make my first muscle contractions in my left leg, and start to move my toes and start to block my knee. And from that to my third treatment, it was in June 2009, I started to record my sexual functions, my bladder, and like all the feelings I need to go to the bathroom. And my right leg start to make some movements and some muscle contractions. To that date, to June 2009, I was driving with my left leg, and I was walking with crutches. And after that treatment, right now it's like a year and a half from the last treatment. I'm walking without any help. I was using my cane. I stopped using the cane like 2 months ago, and I'm flying again from time to time, and driving manual transmission cars and walking normal, and doing everything I was doing.
Yeah, thank you. So somebody had no function below his belly button, and now and he was a commercial pilot, and now he actually passed his medical to fly again, so he's actually back flying airplanes. And he had a recent treatment of about 3 or 4 months ago. This was before that, and he's even better now, but they made the video, and there it is. So those are just, it's completely natural, this whole process. I'll go into the safety issues and the naturalness of this. And Dr. Nocera talked about already about, the naturalness, microchimerism, basically where all mothers have the stem cells from their babies inside of them, and it doesn't hurt them. So it kind of gives us the entire history of the human race as a safety study, because everybody wants you to do safety studies. But to me, it's pretty safe when you can take genetically distinct material from cells from one human being and transplant them into another. In every single case, every person who's alive today, every mother who's alive today, and they're safe. And there used to be a dogma that mothers got autoimmune diseases, particularly one scleroderma. They got it more often than non-moms, right? Because of this microchimerism. So they thought, oh, maybe the immune system attacking them. And they actually did a prospective trial and proved that the exact opposite is true. Moms got it less often than mothers. So for fat-derived stuff, the animals, vet stems treated over 8,000 animals without any serious adverse effects using their own fat-derived stem cells in the United States, right? And they treat, horses and dogs, and they even treat cats now with certain different kinds of diseases. We've treated over 850 patients in our facilities. More than 300 patients have got their own fat-derived stem cells. Over 800 IV infusions. These are the average cell numbers, but here's basically the side effects. We've had one case of a blood clot in the arm. We've had one case, this is after all those hundreds of infusions, one case of flu-like symptoms that resolved within 24 hours. Venous thrombosis resolved in the flu-like symptoms. Right now we're doing a safety analysis with Indiana University where they're looking at all our data and basically contacting patients, and we're going to publish that pretty soon. It's a retrospective analysis of the safety of the fat-derived stem cells. So the umbilical cord cell safety goes back. There are thousands of transplants every year for bone marrow that Dr. Nocera was talking about. Back in the 30s, there wasn't enough blood banks, and so they used to use cords, right? They did thousands and thousands just for blood and that just for a blood transfusion, right? And we know now, of course, they didn't know then, but that there are stem cells in the umbilical cord blood. And the Lancet, there was a paper, there was a doctor in India, treated 128 patients with cord blood, completely unmatched, full of stem cells, absolutely no adverse events. 2005, there 413 units were given with no adverse events. We've given, this is old, it says 500 injections by ICM affiliates. There were 2 cases of rash reported, no other side effects reported. So this, Dr. Nocera already alluded to this. The naturalness of it, the mothers and all that kind of thing. And here's the actual paper and the data. They're 0.32 years per additional child up to 14, and then they died quicker. And I think it was suicide. So Dr. Nocera talked about this. Why can't it be done in the U.S.? And it all boils down to money. Right? If there were a pot of gold at the end of that rainbow, we'd be doing this already in the United States. Unfortunately, this is a medical procedure, right? You're taking a patient's own cells out and giving it back to them in another place, right? So there are regulations in place that don't allow that. The federal government wants to regulate that, right? I think that, we have exemptions, federal regulation exemptions for heart transplant, liver transplant, lung transplant. If you can do that, my gosh, why can't you transplant a few cells? In the heart, there's millions and millions of stem cells. In the liver, there's gajillions of stem cells, and they do liver transplants. They do cornea transplants, and that's all exempt. That is not approved by the FDA. That is exempt under regulation. What they don't want, what they will not allow, is for any doctor to take take stem cells from their patient and give it back to them for regeneration. They will not allow it. Okay? If you're going to get chemotherapy, we can take your bone marrow out. We can freeze it down. In fact, we can give you his or hers or whoever's. That's legal because we want the bone marrow to become bone marrow. But if we want the bone marrow to heal a ligament, no can do. If we can take out your fat, we can store it, we can throw it in a freezer in the back room, literally. And plastic surgeons do this all the time. Pull it out 6 months later, inject it in under your wrinkles to plump up your skin. That's legal because the fat is going to be fat again. But if he were to take those cells out, inject them in your bloodstream to help reset your immune system for an immunological disease, his intent is not to make more fat. His intent is to treat a disease that has nothing to do with the fat. So that's our problem. We basically have one word in the regulations, and it's homologous, like for like. If they remove that one word, everything we're doing in Panama would be able to be done right here in the United States in every state of the union tomorrow by doctors. And I think that's what we need to do. There's a law in the books in Nevada right now that allows for everything that we do in Panama, but it flies in the face of federal regulation. So we don't know where that's going to go. There's proposed laws in Texas, in Oregon, and in Iowa that are very similar to the the Nevada law. And I think eventually there's going to be a critical mass. But I think that we're working on a petition with, well, Dr. Nocera and other groups that basically says every patient should have the right to be treated with their own stem cells by their doctor. These treatments should not be regulated. They should be regulated by state medical boards, not the federal government. So I'm going to play, this is my last deal. It's a couple minutes. This is Mr. Dusty Durrell, and I know some of his people are here, but this was a community outreach that was done, and it's just a few minutes, and I think he has some real poignant points on, just from his personal perspective, and it's just a few minutes long, and then I'm done, and I'll turn it over to Dr. Nocera. Dr. Pauls.
Today we're trying to get the stem cell story of what can be done for untreatable diseases. In this country they're untreatable, like arthritis, multiple sclerosis, type 2 diabetes, heart valve problems that are not treatable, but it has to be surgery. Stem cells are a non-surgical, drug-free treatment that have been curing these ailments in people around the world.
We all have heard probably of the most common one, which is the bone marrow. And the bone marrow has been used for many, many years. Actually, there's more than 20, 30 years of studies using bone marrow stem cells to helping people with hematologic malignancies, leukemias and lymphomas, and other type of conditions where the bone marrow in these people fail. But we found that, again, these cells found in the bone marrow was helping these type of problems, but they had other qualities. And that's really what started the interest of what else was in these bone marrow stem cells that were helping other organs.
Stem cells, they go in, and if it works, they fix you, and you walk out, there's no surgery. They take some stem cells out of your body, wash them in your blood, re-inject them in your blood. The blood carries the stem cells all over the body, and they start fixing anything they find that's broke. And they're successful. Well, if they're successful, why can't we opt to have that procedure available for the people in this country who don't have the means to go out of this country to get treated? We don't have permission to do that in the United States. The USDA has blocked it. I do not understand why. I've been down to Panama where I had a treatment for my arthritis, which was didn't have me wheelchair bound, but I was getting there. I went to Panama, and in 3 days, all my arthritis was gone. What? 3 days after stem cell treatment, my arthritis disappears.
You cited clinical research studies with Miami and NYU. It's hard to believe that there aren't a lot of docs who are more interested in health than the money that would be doing some of this stuff at the outstanding research at the University of this country.
It's amazing, again, but there are. Again, there's Northwestern is doing great study with MS. Again, but even though it's a clinical trial, but the patient to enroll, it costs them like $130,000. And even though they don't say it for the treatment, but it's for the ancillary cost. There's many other ongoing trials that I mentioned there. But the problem is that for it to be significant, you need to recruit so many patients. It's such an expense, and because there's no, again, unless you get private grants and all that, I think the evidence is so overwhelming now that it's going to continue to advance. I really, when do I see it to become a run-of-the-mill approved insurance procedure? I would say 5 years, hopefully less than that.